Okay, welcome back, guys. Today we have a really great case. So this young lady here came to me with chronic regional pain syndrome, which is a severe, it can be in different places, but hers is in her arm. It started after a surgery, and it's excruciating pain. If you know people who have it, it's about as bad as it can get. And a lot of times medically, it never gets better. So this patient has come to me from Minnesota. She comes down, stays with her parents for a week or two at a time, and we've been working on her. This is her second time she's been down, and then we are making progress. It's a very tough condition to fix. We are seeing nice positive changes, but we're not completely done yet. So while she's doing better, and we've helped her out with a lot of other things too, we're going to continue to care for her today, to check her. So I'm going to do the routine exam while she tells you kind of a little bit what she's been through. So if you would, enlighten us on kind of how you got to be where you are.
Well, I did a lot of typing for my previous job and started coming up with the usual carpal tunnel syndrome symptoms, and went into a few doctors, and they diagnosed me with carpal tunnel, and ended up in surgery to get that fixed, and came out 1,000 times worse, and then was told I was misdiagnosed with carpal tunnel, and I actually had complex regional pain syndrome. And then couldn't touch anything, couldn't have anybody walk by me, couldn't take any vibrations or anything. My hand and arm would swell and sweat and get mottled, and all the fun things that come with it. Couldn't move my fingers, couldn't do anything really, and then really worked on solving those, and ended up plateauing. I'm able to do some things with my arm, but fine motor skills are a big no. Trying to pick things up are a big no, and can't lift myself up from a sitting position with my hand. And Mom and Dad were really adamant on getting me to come and check you out, and because you had so much impact on their ailments, and finally just bit the bullet and said, why not?
So, the ticket,
yeah, even though I was scared to death of any chiropractor touching me, but I figured if I can work through and make myself better already once before, then I can do it again if things were to go bad again. But things only got better. So now
what else did you have too? You had some other problems we helped you with too, right?
Reflux, IBS, lower back pain, mid back pain, upper back pain, neck pain.
IBS,
yeah, pretty much everywhere. IBS issues, gone. Reflux, gone. I was able to, for the first time in 6 years since getting diagnosed with CRPS, I was able to actually sit outside and have skin exposed to sunlight, and it didn't feel like my skin was being melted off my body.
Wow.
So it was so nice. I was almost in tears because I could actually be outside.
It's crazy what people live with, and the medical community, they do their best for people, but they're just kind of they have a program for everything, and chiropractic is not part of any medical protocol for any of these things. So most people never get to a chiropractor at all, and if they do, they may go on to just randomly manipulate. So cases like this, you have to be ultra specific. So that's why in the Gonstead work we use a set of films. We check her like you saw me doing with that instrument with my hands, and we only correct what needs it. And we leave what's good alone. So she's had amazing progress. It's the work's not done, but we've been able to give her more relief than anything has to this point. So I checked her again, found a few areas we're going to adjust. The upper ones are more related to kind of her hand and her pain syndrome, but she still has a little bit of pressure in her low back. So we'll continue to work on that so that it gets better as well. All right, so let's actually start on your stomach. So because some people are apprehensive about chiropractic adjustments, and we've come a long way together because a lot of it's about trust. A lot of people just are initially scared, but as you work on and develop trust, they'll let you work with them different ways. So like the neck adjustment, we've just recently been able to start doing that in the chair. We started off doing it on her stomach because it's not near as intimidating for people who have that kind of apprehension, but she's doing great. So we're going to start low on her low back. Work on that fifth lumbar a little bit. So I do this one here as well, prone. I could do it there, but she seems to do really good right here with it. just going to take a real specific contact on that lower lumbar. Just kind of work it back into place and then get a nice little set here. Perfect. Good. All right. This upper thoracic. When people have hand problems, thoracic outlet type of syndromes, and then obviously severe conditions like this, even down into the mid-back starts involving that area because it causes, spasms in the chest wall, which can constrict vasculature. So we always make sure we check it. Perfect. All right. Spotty, we can get you up, and we'll work on that last one in the chair. But yeah, you can just tell by her story how a condition like that can just totally affect your life. You can't use an arm, you can't even get sun on it. That's crazy. All right, slide down a little bit. Appreciate it. Now we're going to set this nice and light for you. Perfect. Great. You recheck them. So, like I said, we're just continuing on. She's got to go back home soon. We'll let her go home for a while. And maybe in a month or two she'll come back down and we'll do it again. All right, that did great. I hope that helped you guys. I hope somebody will see this that has a similar condition and we can get the help they need. So until we see you next time, bye-bye.